Hi, I'm Annie Newman, Respiratory Therapy Director with StateServe Medical. With me today is one of our lead technicians, Emilio Benzo. We're here to discuss best practice use for oxygen regulators. Oxygen flow regulators refine and regulate oxygen output pressure so that cylinders may safely be used by patients. Regulators allow for an adjusted flow to ensure patients are able to receive oxygen at their prescribed optimal level. Prior to using the regulator, please review the following safety considerations. For your safety, it's imperative to understand that oxygen has the potential to be dangerous if not used correctly. Specifically, oxygen should not be used near an open flame or any fire source. This would include cigarettes, matches, lighters, candles, a heat source, which includes radiators, heat ducts or stoves, or fireplaces. Oxygen should not be used near petroleum-based products such as Vaseline. Caution should also be taken when using alcohol-based products, including hand sanitizer. Do not use oxygen near any aerosols, such as hairspray or spray paint. When in use, a cylinder should always be kept in a stand or cart. Extra cylinders should be stored on their sides or in an oxygen cylinder rack. Do not allow side-stored cylinders the opportunity to roll, as if valve damage was to occur, there is the potential for the cylinder to explode or ignite. Do not leave cylinders in unsupervised areas, such as in your vehicle. The oxygen regulator consists of these 5 important components: a liter per minute flow indicator, control knob, pressure gauge, T-handle or toggle, and nipple adapter. Next, we'll discuss how to change an oxygen regulator. Remove the valve post white seal band and assess to ensure there's no visible debris around the perimeter of the stem or the cylinder valve hole. Make sure there's a washer on the regulator. Next, attach the regulator to the cylinder by slipping the regulator over the valve post. Align the front of the cylinder, which has a large cylinder valve hole, with the pins on the regulator. Unless the stem has a toggle, instead simply slide it over. Align the pins with the holes on the valve post. Slide the pins into the holes, turning the toggle until firmly tight without leakage. If there is a leak, realign the pins and assess the washer. If there is no toggle, instead, attach a cylinder wrench. Place the regulator to 0 liters per minute or in the off position. Open the valve by fulfilling a quarter turn. Think righty-tighty, lefty-loosey. Adjust the regulator to the patient's prescribed liter flow. Then attach the oxygen tubing to the regulator nipple. To remove the oxygen regulator, make sure the cylinder valve stem is closed and bleed out any remaining oxygen until the regulator needle is resting in the red portion of the gauge. Turn the T-handle to loosen the regulator prongs from the cylinder. Slowly slide the prongs loose from the valve post, removing it from the cylinder. Please visit stateserve.com for additional information. Thank you for your time and attention.